Hello, I am Dr. Chirag Thakkar and today I am going to talk to you about GERD, that is gastroesophageal reflux disease, heartburn and hiatus hernia. What is GERD, that is gastroesophageal reflux disease? What is hiatus hernia? What do we mean by heartburn? What are the risks related to this condition? What is the treatment? Can surgery be of any help? I am going to discuss about all these things today.
First, let's see what happens when we eat. When we swallow, food passes through a tube called esophagus, or what we call a food pipe. It is a long muscular tube that carries food from the mouth to the stomach for further digestion. Contractions called peristalsis push food down the esophagus. At the bottom of the esophagus, food passes through a muscular one-way valve called the lower esophageal sphincter or the LES. The valve relaxes when you swallow, allowing the food to pass into the stomach. The valve is designed to close tightly after you swallow so that nothing comes back into your food pipe. A breathing muscle called the diaphragm is a sheet of muscle that separates the chest from the abdomen. To reach the stomach, the esophagus passes through a hole in the diaphragm called a hiatal ring or an esophageal hiatus, or simply a hiatus. Your diaphragm is also meant to pinch securely around the esophagus, strengthening the valve. Certain cells in your stomach called proton pump releases acid to help digest the food. The lining of your stomach protects it from the acid, but the food pipe has a different kind of lining which can be damaged by acids. When the stomach contracts to move the food into the intestine, the valve closes tightly in order to prevent these acidic juices coming back into the esophagus, where it can cause damage. It is normal for a small amount of acid to occasionally splash into the esophagus. This is called reflux, which means flowing back. But when the valve becomes weaker, it doesn't close tightly, allowing the acid and partially digested food to splash up into the esophagus repeatedly and in large amount. This is called gastroesophageal reflux disease or GERD. Gastro for the stomach, esophageal for the esophagus. As the acid damages the esophagus, you feel the burning sensation in the lower middle part of your chest, which is called a heartburn. Sometimes the diaphragm weakens around the esophagus, allowing the hole called the hiatus to become larger. When it becomes larger, part of stomach may bulge through it towards the chest. This is called a hiatus hernia. The hernia may cause the esophagus and the valve to move up in the chest. In that case, the diaphragm is no longer reinforcing the valve. That makes it more likely that acid will get into the esophagus. A hiatus hernia can affect the valve and increase the risk and severity of reflux. If acid splashes into the esophagus over and over again for years, the esophagus can be damaged, leading to a variety of esophageal problems, including ulcers, bleeding, stricture or narrowing, and Barrett's esophagus. Barrett's esophagus is the abnormal growth of intestinal type cells in the esophagus that can lead to cancer. If you are having reflux, you may have heartburn, that is the burning sensation in the lower part of your chest. You may also feel food or acidic fluid to come back to your throat while you are sleeping or bending forwards. This happens more frequently if you sleep or bend down shortly after meals. Long-term GERD can cause difficulty in swallowing, coughing, breathing problems, asthma, and chest pain. The chest pain can sometimes mimic a heart attack. So if you have a chest pain and your cardiologist say your heart is normal, this may be GERD. If you have the above symptoms, then you should get an upper GI endoscopy done. This will give the information about the weakness of your LES valve, presence of hiatus hernia, damage to the esophagus, H. pylori infection, and gastric or duodenal ulcers. Esophageal manometry and 24-hour pH and impedance study are the investigation that may be required if there is any doubt about the diagnosis or if we are considering a surgery. The treatment is mainly divided into medical treatment and surgical treatment. Medical management includes medications to lower the amount of acid produced by the stomach, treatment for H. pylori infection if it is present, diet and lifestyle modifications, and losing weight if you are obese. Elevating the head end of your bed while sleeping also helps. Lifestyle modifications include quitting smoking and alcohol, avoiding spicy and fatty food, regularizing sleep and food timings, measures to get rid of stress, and meditation. An initial 6 to 8 weeks course of antacid medication is required along with these lifestyle modifications. If you are improving on medications but again having problems when you stop them, then you should consider the option of surgery. You can either consider to take long-term medications or undergo surgery. Both are standard line of treatment, each having their own merits and disadvantages. But if the endoscopy suggests a large hiatus hernia, esophageal ulcers, esophageal narrowing, or Barrett's esophagus, then I will strongly recommend surgery as a more preferable option. Also, if GERD is forcing you to sleep regularly with your head end raised, or you cannot sleep due to reflux and coughing, surgery will be a boon for you. For all such patients, an operation called laparoscopic fundoplication is an appropriate treatment. Fundoplication is done to treat GERD or to repair a hiatus hernia. Fundus refers to the top part of the stomach. Plicate means to fold. In this operation, a portion of the upper stomach is folded around the bottom of the esophagus and secured to support the valve. The surgery is performed by a laparoscopic method by creating 5 tiny holes in your tummy wall. Laparoscopic fundoplication surgery is done under general anesthesia, which will put you to sleep for the duration of the operation.
You are supposed to be fasting for at least 6 hours before the scheduled time of surgery. Though, you need to take your regular heart or blood pressure medications with sips of water if they are routinely scheduled during these 6 hours. As you will be fasting, you need not take your diabetes medications. You should confirm this with your doctor if you have any doubt. If you are on blood thinning medications, you should ask your doctor whether you need to stop them before surgery.
A breathing tube will be placed through your mouth into your throat to help you breathe during the surgery. This will be removed at the end of the surgery. To gain access to the abdomen, we will use sharp instruments called trocars to create 5 small holes in your tummy called ports. The location of these ports will depend on our preference and your body structure. Carbon dioxide gas is then pumped through one of the ports to puff up your tummy. This helps us to clearly view the contents and also gives us space to complete the surgery. Next, we will insert a laparoscope through one of the ports. Laparoscope is a long thin tube equipped with a light and a camera. Images from its camera are projected on the monitor in the operating room. Through other ports, we will then insert other instruments, which will be used to separate the fundus of the stomach from its surroundings. If you have a hiatus hernia, we will pull the herniated part of stomach back in the abdomen. We will also tighten the hiatus to prevent further hernia. If the hiatus is very large, a piece of mesh may be used to reinforce the hiatal repair. After separating it from the nearby structures, we will wrap the fundus, that is the upper part of your stomach, around the lower part of the esophagus and stitch it into place. This wrap acts as a belt which tightens and strengthens the LES valve. We will finally have a look to check there is no bleeding. A port valve is briefly left open to allow all the carbon dioxide gas to escape from your abdomen. Finally, the keyhole incisions are closed with sutures and covered with bandages. An uncomplicated laparoscopic fundoplication usually takes 60 to 90 minutes. After surgery, your breathing tube will be removed and you will be taken to the recovery room for monitoring. You will be given enough pain medications as needed. You will feel a bit sleepy immediately after the operation due to the sedative medications given during anesthesia. You should try to move the limbs and sit up soon after surgery. Most patients can walk and go to the toilet in 4 to 5 hours after surgery. There are no restrictions whatsoever for physical movement. In fact, majority of the patients will feel much better after they have started movement. The pain also reduces dramatically once you start sitting up, moving and walking. From the next day of surgery, liquids like water, tea, coffee, milk, juices, soup, and dal water can be started. In case you vomit, there is nothing to worry about. We will stop giving you liquids and restart it after some time. Diet is then gradually progressed to soft diet for a week and then normal diet. Few patients may feel a little difficulty in swallowing in the initial few days. This is because of the handling of your food pipe during the surgery and should settle down in few days. We routinely discharge the patients in 2 to 3 days after surgery. Hospital stay may be prolonged for patients with heart, lung or kidney disease as per their disease status. You can take shower from the next day of surgery. Usually there are no stitches to be removed and you will only require a wound dressing in the follow-up consultation. You can resume your routine household and office work in a week's time as you feel comfortable. You can drive a car or a two-wheeler in a week, can walk as much as you want, and can climb a couple of flights of stairs. In fact, these are the major advantages of laparoscopic surgery. Most patients who undergo laparoscopic fundoplication surgery enjoys long-lasting relief from symptoms of reflux. Even after surgery, we recommend to continue with the lifestyle modification that are advised in the medical management of GERD. Ideally, everybody should follow it to lead a healthy life.
Hope you have got the answers to your questions. If you have any further question, you can meet me with prior appointment. Feel free to ask any question that may come to your mind. To book an appointment, call 079 2970 3438 or 84693 27634 or log on to www.drchiragthakkar.com or email me at drchiragthakkar1307@gmail.com. Wishing you a happy and a healthier life ahead. Let the inner healthier person come out of yourself.